First 24 hours after birth, your baby goes through a lot of tests and interventions. Let's go over them. I'm Dr. Dalmaz. I'm a concierge pediatrician in New York, and I help families optimize their baby's development in those critical first 1,000 days. First of all, your baby is going to get vitamin K shot. This is really important to prevent vitamin K deficiency related internal bleeds, including brain bleed, which can happen up to 6 months of life. One question I get in my clinic, because I have a lot of European moms, is that why are we doing a vitamin K shot instead of doing oral vitamin K like back in Europe? The reason we do that is vitamin K shot is just more effective and it's just one dose instead of multiple oral doses like in Europe. The second thing your baby is going to get is erythromycin eye ointment. This is for preventing gonococcal infection in the eye, which can cause blindness very fast if it is untreated. And I get questions from my moms that, hey, I got tested for gonorrhea and I am negative, so why am I going to give this to my baby? And the reason is, A, there is something called false negativity, meaning that you have the disease, but you get tested and it is negative. And the second one is, yes, you may be negative today, but you might get gonorrhea between today until birth. So if you're for sure that there's no chance that you have this, you might be able to skip this one. I also get the same questions about hepatitis B, and I understand that. That's why this conversation should be between you and your pediatrician. But the reason we give hepatitis B vaccine is because back in the day, we had so many cases of hepatitis B infection. And when we give this in a newborn, we prevent serious long-term complications. And we actually decrease these infections 99% since we implemented in 1991. Another test your baby is going to have is newborn screening, which is a heel prick. We test 50 plus conditions in New York, and every state does it differently. But this is extremely important. We check for genetic conditions. We check for endocrine conditions like hypothyroidism. We check for cystic fibrosis and many, many things. So this test is essential. And this test comes back in a few weeks. And if it is negative, you're not going to hear anything. But if it is positive, you're going to be notified by the State Department. Your pediatrician's office is going to be notified by the State Department. Your birth hospital is going to be notified by the State Department. So everyone will be calling you if anything comes back positive in this test. Another test your baby is going to have is oxygen test. We put a sensor in the right hand and a sensor in a foot, and we basically try to detect critical congenital heart conditions. Hearing test is another one that's very important because we have a very critical window in babies to diagnose them with deafness and start treating them immediately. Another thing hospital is going to check is the jaundice level. Between 24 to 48 hours, they're going to look at their bilirubin level, which is the jaundice level, and they're going to use certain tables to calculate certain things, and they can explain that to you. And if you as a mom are Rh negative or blood type O, the cord blood might be used for checking the Rh and the blood type of the baby. So in summary, there's so many things they check in the hospital to make sure your baby is safe enough to go home. And if you do a home birth, I'm going to make another video. There are certain things you need to do in your pediatrician's office to make sure everything is checked.